Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Darci, tell me what's going on with your back.
Back pain.
Yeah, back pain. What happened?
Just soreness. When I'm working.
Okay.
Walking. At first, I couldn't drive longer than about 5 or 10 minutes.
Can you give me a little brief history about what kind of surgery you had, like procedures and stuff like that?
2014, a left L3-4 fusion.
Okay.
I have residual pain in the left knee, kind of a numbness, tingling, sometimes mostly just kind of numb. Then 2017, January, I had the right L5-S1 microdiscectomy.
So you had 2 surgeries. Okay.
Was scheduled for the third one today.
Okay.
3 weeks ago, the right leg pain completely went away.
We just want to give a note here. When you decide to come and see us, you're going to feel better before even seeing us.
Right? I knew I was going to get treated good, so it's like the pain decided to leave.
That's
right?
good. Yeah. Awesome. Good for you. So currently, like, what kind of treatment you had for this other than the surgery for your back?
The back, I haven't really had any treatment.
Like physical therapy or chiropractor or something like that?
The chiropractor will work on my upper back. I don't let him touch the bottom
the lower back.
at all. Because
you have fusion, so yeah.
Yeah. So, and I just had so much pain in the L5-S1, I wasn't going to let anybody touch it.
Have you had physical therapy for your back? Or?
Oh, I did have... I tried therapy, yes I did. I went to one person and they were trying to do active release technique, which they weren't really doing it, so they kind of scraped my skin, and so I didn't go back there. And then I went to somebody who, the first thing she did some manual, like soft tissue, but she wanted me to start doing bridges. And
really?
It was right when I was post-microdiscectomy. Yeah, I had 3 sets of 3 different types of bridges. She started me at a repetition of 10, so I was doing 10 times 6, and I asked her to justify it, and then she kind of did. I said, all right, well, I'm going to tell you if I start having pain, I'm out of here. So then that was on a Tuesday. Thursday, she upped all the sets to 20, and the following Tuesday she upped them to 30.
Oh my gosh.
And by that point, the pain just was zapping me like crazy.
That's one of the exercises I actually avoided.
I will never use it.
I will never give it to my patient for back pain. The bridges, I will never do that because you're going to have a lot of flare-up. That will cause a lot of muscle spasm.
Yeah, I wasn't doing full bridges just because I knew, but...
Yeah.
So then I didn't do any more therapy. I've just kind of done it myself.
So that's a second therapy. Okay.
Yeah.
All right. So what can we do to aggravate your symptoms? Yeah, I know today you took your pain medication. So can we do like some motion that you will feel the tightness so we can assess it?
I'm sure like if I did repetitive maybe
let's stand up and we'll try the range of motion.
Do you have some stuff you need moved?
Yeah, can you move this table?
I actually could, yeah.
Okay, no, not now. Just turn around facing me. Let's do side bend and tell me how much tightness from 0 to 10.
This way. I actually only feel it like maybe a 1 over here.
The other side?
I do feel pressure here. This way, probably right now maybe like a 3, but if I keep doing it, it'll get worse.
Okay. So can do flexion? You have a good range of motion. That's good. Yeah. Any problem with that?
About right there, you feel it like low, like the muscles are grabbing.
Okay.
And then nothing else the rest of the way.
So because I want to stimulate the symptoms, okay, let's do, which one gonna be worse, the flexion or the side bend?
Probably the flexion. I'm gonna
flexion. Okay, let's do 10 flexion and tell me when the pain goes up. But I don't wanna. I just wanna stimulate it because we're gonna do the same thing afterward.
Okay.
Okay.
So just 10.
10.
Okay. get to do this with my legs straight.
Mm-hmm.
See, the pain pill's making it not kick back in like it normally does.
You feel it or no?
I'm actually just feeling it where I substitute on the left side the most.
How much from 0 to 10?
It's probably like still like 3 or 4.
3 or 4. Do the side bending.
I'll do it against the way that normally hurts.
And actually, I visually can see your upper body shifting to the left.
Yeah.
And lower body shifting to the right from your hip. And is that how long this been going on?
I have no idea. I have just been working and substituting like a bad therapist.
Mm-hmm. Can you tell us about what kind of therapist you are?
Physical therapist.
Awesome.
Orthopedic.
Yeah.
Sports.
So you do a lot of work with your hands.
Yeah. So I'm like up on the table. I'm lifting legs and whatever.
Oh,
yeah,
you're doing stretching.
Yeah.
How much tightness you feel now?
Probably the same, maybe 4 or 5-ish.
Okay. All right. So we'll have you sit here, and I will work with you. Okay. So let's go to the side. We'll have you sit here. At the edge, like facing this way.
Okay.
Okay, that's the last one. Alright, so it can feel cold, okay? So I can see the surgery here. Sorry, my hand is cold.
Yeah, it's okay.
Wow, they did a big cut.
Yeah, it was the first one, the fusion. And then the second one they just kind of did on the lower part of that.
Okay. So you feel the tightness in your fascia here?
Mm-hmm.
That's a tight fascia.
Mm-hmm.
And I'm gonna release it now. Okay. Make sure it's not painful.
Mm-hmm.
You feel the mobility now? You feel the movement?
Yeah.
Okay. So that's moving. So I'm using the instrument here. Feel the tightness here?
Yeah.
It's not moving. And so I'm releasing your superficial fascia.
Cool.
Okay, I'm going down.
Mm-hmm.
I'm gonna go deep to actually get to the apparatic fascia.
Go deep.
Okay. Make sure it's not painful, okay?
Mm-hmm.
You feel the mobility now?
Mm-hmm.
Here? You feel the movement? Okay.
Yeah.
But why they cut this big cut?
That was him. I don't know.
Yeah.
I assumed
because he said L3, L4?
Mm-hmm.
Okay.
Yeah.
Yeah.
But like he was gonna do. I went to him first. He did the first. He did the 2 surgeries, and I was going to go back to him, and I did, and I said, "Well, what do you think?" And he goes, "Well, what do you want to do?" I'm like, "You're the doctor."
Oh boy.
Tell me what's going on. So I went to a spinal surgeon up at Cedar Sinai, and he was good.
That's good. So I'm interested actually if we can change your shifting.
That would be awesome.
So because, but you don't remember how long this been going on. Is it before the surgery or after the surgery? Because I want to know that.
No, it was. January when I had the microdiscectomy. It had to be after that. I mean,
after that, it's just compensation.
Yeah, because I was still recovering and I was doing therapy on my boyfriend, and then I finally got him to the Hoag Hospital for his, and then I got really busy at work, so I was doing like I don't have AIDS or anything. It's just me.
Are you serious?
Yeah. So, and I was doing like maybe 9 or 10
physical.
people. I know.
Oh my goodness.
I know, and I'm only 28.
Why you
just
do
kidding.
that?
Because it's just the way it is right now.
Oh my goodness, that's a lot of hard work.
Yeah.
Yeah.
Why do you think I'm taking your course?
Yeah, I know.
Somebody has to teach me how to not be like the manual laborer.
Yeah, it's hard, especially when you have like a lot of patients and you become manual.
I've already started introducing them to the fact that, because I have one of the percussion machines too, so sometimes on the big bottoms and the IT bands, I will use a little bit of that now.
Okay, so I'm gonna do deep fascia release.
Okay.
Epimycin and epimycin, okay? This is not needle, okay?
No, I'm just like, they're very cool instruments.
Yeah,
so.
yeah. This is...
Like I said, I researched the other guys that kind of have similars, and like, what's that one? It looks like brass knuckles with like half a moon of thing. Yeah, and it's like, wait, that's gonna hurt me to use those.
To be honest with you, I know 2 people had trigger finger from those instruments. Just because they use it. It's just ergonomically not designed. It's not designed ergonomically.
See?
You know? And
I saw your video of these, and I'm like, okay, this is the one.
This one?
These ones when you're using it on people, because
it
just makes sense, yeah.
Yeah, like...
I did the same when I took a seminar on making orthotics.
Yeah.
And I researched them all and took the one that made the most sense.
Yeah, because when I was thinking, because before I came up with this instrument, I'm like, okay, I need to have an instrument to break the scar tissue. And I looked and I was like, I bought several of them. I'm like, man, this is painful actually to use. So...
Somebody, one of my patients, she changed her insurances, so she just had a total knee done. And
you're gonna feel cold, okay?
Okay. And they used one of the, is it Grafton?
Grafton.
Yeah. So they used that half metal disc thing.
Oh man.
Straight over her new scar.
Oh my goodness. And what happened?
She's like really sore and inflamed.
Well, here's the other problem I have with them, that they teach in their class, you know, in a normal healing cycle, inflammation, proliferation, maturation, they teach in the class that we want to cause more inflammation. We want to stimulate inflammation. I'm like, it does not make any sense.
Yeah, they've got enough of it already.
It does not make any sense. Patient has inflammation. That's mean you're gonna cause more scar tissue from the new inflammation.
Yep.
I had a patient that had bilateral carpal tunnel after having this treatment. Ended up with bilateral carpal tunnel plus bilateral tennis elbow because they cause inflammation in the elbow, and it's sad. It's really sad. You feel this bump here? That's a scar tissue.
Yeah, you've hit a few spots already that I can feel. Not painful, just feel them.
Yeah, as long as you feel pressure, that's fine. But pain is not fine. You feel that here? Okay. I usually do it in other position, but we're doing this because of the camera. So what kind of manual technique do you use on your patient?
Kind of a lot of them. And kind of so it's like whatever works. So I actually
used everything.
Yeah.
Like, you know, you get to the point, this help a little bit with this, this help, and you realize you're doing 6 techniques.
Right.
And spending an hour just doing those 6 techniques.
That's it.
You know?
Well, and I used to be the supervisor at like the outpatient clinic Long Beach Memorial, and the girls would go to a seminar and then they would use it on all the patients, and I'm like, how's that working? Because not everybody needs the same thing. So.
Yes.
But except maybe this. I'm kind of liking this. But since doing the side bending, I do feel it like right over here, like a lot.
You feel it now? Okay.
Yeah.
How much from 0 to 10? Right in here?
Yeah, it's going from like right here kind of to here. It's about it's probably like still a 5 or 6. Okay. It's hard for me to judge because I just tolerate pain for a long time now.
High pain tolerance? Okay.
It's been a long time. Yeah. I think sometimes...
It's too much.
Okay, yeah. I was just going to say, sometimes I think I throw that SI joint out too from substituting.
Okay, I will show you how to fix it by yourself. What do? You do muscle energy?
There has been one that I've done, kind of like, you know, you're pushing against the knee in that laying down position and stuff, and sometimes it works and sometimes it doesn't.
I will give you, after the video, a quick maneuver. You can fix it by yourself. You don't have to do muscle energy. Yeah, muscle energy... does not last.
Thank you.
Yeah.
I was was going to say it doesn't work.
Yeah. You use the strain counter strain. I used to use the strain counter strain, muscle energy, myofascial release. I use all of that.
Sometimes the strain counter strain does, but like some of the other kind of techniques they've used for muscle energy.
Even the strain counter strain, the study shows it's not really
doesn't stay.
It doesn't stay. No. Systematic reviews actually. Yeah, I had to look at all of that to come up which one is working, which one is not working. Unfortunately, it's not promising for a lot of techniques. Okay, how does feel now? 0 to 10.
This feels really good. I still have that one like right there.
Just in here?
Yeah.
Right in here. Right in here. Just this spot, yeah? Make sure it's not painful, okay? Too much?
Actually, I like that one.
And so I'm trying to get, actually with this one, try to get premiycin and endomycin with because it goes deep. Okay. Still feel it? It's gone.
Gone?
Okay, let's stand up. I will actually listen this way.
Her?
Yeah. And I'll just move to the side. So let's do the flexion and tell me how that's going.
Good.
Okay.
What do you want me to do? The 10?
The side, the 10. Because we
10?
tested with the 10. Okay, I want you to do something. Strain, pulling your head up and bend while you have a good posture. Yep, good. Let's look better. You're flexible.
Yeah. I stayed flexible for a reason. I was just
You're
frustrated.
hard to move, yeah?
I was just frustrated because I knew I wasn't flexible here. I'm flexible here, but my back wasn't moving. That's why I wanted to have a manual person. Yeah. So. Okay.
Did you do 10 of that?
I don't know, 9 or something.
Okay.
Yeah, this one feels like better too.
You definitely need to do a lot of work on your range of motion. Yeah. You have
this one for sure, right?
Do you have one?
You know, I think it appears like that. I don't think it is. I think I'm kind of like that.
Okay, we'll work on that.
Because this is up too from the shoulder, and
let's finish 10 this way. Did you have any stomach surgeries?
I had a dermoid cyst removal.
Here, up here?
It's like a cesarean scar right here.
Okay.
So.
I have female therapists, we'll let her work on that.
Oh, okay.
If you're comfortable with
yeah.
Did you do 10 side bend?
Huh? Side bend, yeah.
10?
Yeah.
How you feel?
Good. I didn't feel any of it over here. At the end I was feeling just a tiny bit there, but it wasn't even, it was like not even a 1 probably. It was just that little bit of kind of pressure, that was it.
Okay.
So.
So what do you think about the treatment?
Nice.
Awesome. Yeah.
I found somebody.
Yeah, thank you. Yeah.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.